Hello everyone! Today we're going to talk about oral mucosal cancer. We'll cover what it is, its symptoms, why early diagnosis is so crucial, and some risk factors, so let's get into it. Oral mucosal cancer is one of the most aggressive types of tumors with a high rate of recurrence and elevated mortality. That's why it's so important to be aware of the signs and symptoms of oral cancer. More than 60% of patients are diagnosed when the cancer has already reached stages 3 or 4. This is why early detection is so important. Early diagnosis of oral cancer increases the chances of successful treatment and recovery to more than 90%. Malignant tumors can appear in various parts of the oral cavity, including the tongue, floor of the mouth, buccal mucosa, which is the inner lining of the cheek, gums, and the palate. In the early stages of the disease, a patient may notice painless nodules, superficial ulcers, or cracks that do not respond to usual treatment. A burning sensation or tingling in the mouth while eating can also be a sign. If these symptoms persist for more than 2 weeks, even after starting the treatment prescribed by the doctor, it is advisable to consult an oncologist. The specialist will perform a thorough examination, including a morphological study, which can help detect malignant tumors at an early stage. Why does early diagnosis matter? Early detection allows for successful treatment of oral cancer in more than 90% of cases, while also preserving oral functions. However, in more advanced stages, particularly stages 3 and 4, the 5-year survival rate drops to 23 to 42%. This means that almost half of the patients will not survive 5 years after diagnosis. Statistics show that early detection of oral cancer can prevent up to 80% of deaths caused by this disease. Doctors identify several factors that contribute to the development of oral cancer. These include unhealthy habits such as smoking and alcohol abuse, especially when combined with poor oral hygiene, chronic inflammation and infections, chronic diseases such as diabetes, and injuries to the oral mucosa caused by cavities or low-quality dentures. I hope this was helpful. If you have any questions or concerns, please don't hesitate to reach out to your doctor. Until next time, stay healthy and informed.